Hi, my name is Bert Parcells. I'm an orthopedic surgeon and I specialize in hip and knee surgeries. I'm a surgeon with Seaview Orthopaedics and we're located in central New Jersey. 85 to 90% of patients develop arthritis throughout their whole knee, and as a result, they need a full knee replacement. However, there is a select group of people that develop isolated arthritis, and as a result, they're a really good candidate for a less invasive procedure called a partial knee replacement or a unicompartmental knee replacement. And so to talk about that, I first want to just quickly review kind of how arthritis works in the knee, and then we'll kind of talk about the procedure of a partial knee replacement. So this is a model of a knee. This is the front of the knee, these are the sides, and here's the back of the knee. So if you move the kneecap to the side, we're going to look at the inside of a knee, okay? And I've used a highlighter to draw where the cartilage is at the end of the bones inside of the knee. What happens with arthritis is that over time, that cartilage gets worn out. So if you can imagine, we lose the nice blue cushion and you're left with just bone. Some people only lose cartilage on the inner side of their knee, and then some people lose cartilage throughout the whole knee. Now, if you only get cartilage loss on the inner side of the knee, it really doesn't make that much sense to then go and take away a lot of healthy cartilage and kind of do a much bigger surgery. It'd almost be like repaving an entire road if you only have a pothole. And so a partial knee replacement allows you to just focus on the one area of cartilage loss. So with a partial knee replacement, what we're going to do is just take like a dental burr and burr out about 3 or 4 millimeters of that arthritis on each side of the joint. We're going to remove that torn up meniscus because that's always damaged when you have severe arthritis. And now I'm going to show you in a different model what a partial knee looks like. So if you compare the two, you've preserved all this side of the knee. You've preserved the cartilage behind the kneecap. And what you've done is just put a little metal liner that's kind of quite thin on the femoral side and the tibial side, and then there's this small piece of plastic between the two metal caps in order to prevent metal from rubbing on metal, which is something you don't want. To show you again the way a partial knee replacement is done is we take a burr and we remove just a very, very slight amount of bone, and we create these two little peg holes, and then we affix this small metal cap to replace the missing cartilage. And you do the exact same thing with the tibia, where you just burr out a very small amount of bone, and then you're going to place a metal strip that's only a couple millimeters thick to replace that cartilage, and then you place a piece of plastic between the two, and that's it. Now, if you want to compare recovery between a partial and a full knee replacement, a partial knee replacement recovers about 3 times faster. It's always an outpatient surgery, meaning patients come in, the procedure is 1 hour, and then they'll do a little physical therapy and head home that day. They get a nerve block to really prevent the need for a lot of pain medication. By 2 weeks, when you come back to see me in the office, most of my patients are walking independently. Some are using a cane, but most are getting around really, really well. They're bending their knee to well past 90 degrees.